Happy Future
Podcast.
Free healthcare. You hurt your back. You go to the hospital. You don't have any money. You check in. They let you see a doctor. No problem. You're here with Cosmosis on the Happy Future Podcast. Today we're discussing free healthcare. Yes, for free. No money, no problem. So we're talking about free healthcare for all citizens. Doesn't matter how you look. Doesn't matter what your ailment is. You're going to get free healthcare. But how is this going to work? How is people going to give you free healthcare? So that money has to come from somewhere. Some kind of tax. That's the only way free healthcare will work. You got to have some kind of tax. You can tax the rich won't like it. You can tax normal citizens, but they don't have so much money in the first place. So we got to find ways to tax most likely normal citizens where it won't hurt their pockets too much. Or they won't know. There's always the likelihood, if you can tax someone and they don't know, that's a little secretive. How about taxing them, but you're helping them with the tax? And that's one of the suggestions with a VAT tax, a value-added tax on the production of some good or service. It could help people. One of the ways you can tax can be on food. In the U.S., there's obesity problem. One of the most obese nations, large nations throughout the world, they can do with a VAT tax. You tax, every producer and seller of food all the way up to the citizen. The end tax will be on the citizen. And they can use that money, the government can use that money to offer free health services. This is in comparison to like a sales tax, where you'll take the entire tax and you'll tax it on one individual. If you split up the tax and you tax it through each level of its production, whichever good, in food in this instance, you can recoup the taxes incrementally and ensure you get that tax. Because, this is for the public, and there's a large public. You got to make sure you got that money to cover for those medical expenses. Now, this is opposed to the sales tax, of course. But even with that tax, say we do a value-added tax on food, why is that helpful for a citizen? Well, like in the U.S., there's an obesity problem. People are over-consuming. They're eating maybe too sugary foods, too much cholesterol, too much salt. So if you want to eat a lot of food, you got to pay, a hefty price. You're helping out normal citizens with health issues, because there's a lot of citizens, that pay taxes for things that maybe they shouldn't pay taxes for. Like, if we have a tax on food that goes toward healthcare, people are eating really bad food, they have to go to the hospital all the time. Shouldn't they pay the bulk of that? They should. It's the same with the automobile industry. You pay a premium for your car insurance based on other people doing bad driving. Shouldn't the people who have a clean record pay little to nothing for their insurance? The same thing goes with a tax for healthcare. So, I would say a food tax will probably be the best option. Something that's fair, everyone eats, everyone needs healthcare time to time. But a lot of people don't go to the hospital. There's a good amount of people who just doesn't get sick. They eat food. They will pay a slight tax, and I'm pretty sure they probably eat a little healthier. So that might work out. There's always going to be some people who are going to be disappointed about the additional tax, but you're offering free health care. Now, the question is, how much tax? That can be worked out. How much VAT tax would you have to charge, so that health care, is covered? And if you think about it, it can be done. People buy food every week, every month, every day we're buying some kind of food. If you can tax just enough, let's say $2,500, $2,500 US dollars worth of tax per individual, we can cover their medical expenses. On average, we can assume people need to go to the dentist, for checkups. People need to go maybe get some checkups at the hospital or at the local clinic. They might get a broken leg here and there. They might get an infection. How much does it really cost to get seen for infection, get some basic prescriptions? I would say $2,500 is reasonable. Anything else, say you need some additional coverage, say you need some additional work, shouldn't you just get your own insurance? You can get another private insurance. If you need more health care outside of that $2,500, which I guess would be a stipend, you can just get some additional insurance. Actually, this can be good for the insurance industry, for citizens, because citizens can get competitive rates for insurance. Now these insurance companies have to compete to get your business. Before, there was no government tax-based healthcare, no proverbial free healthcare. Most people today, they will just go to the hospital if they're sick. Government will try to find a way to write it off or try to attribute it to welfare. But that system is a flawed system. No one's paying for their problems. They have to find a way so that we can balance the economy, so that we can have a system that we can be dependent upon down the line. Free healthcare is a must. This is something that's a necessary component of human survival. You have to be taken care of one way or the other. The rich must take care of the poor must take care of the poor, even the poor takes care of the rich. So we need health care. That's a given. And there's going to be some negatives, to having free health care. There's components of the free health. There's going to be people who are going to leech on politicians who are going to say, we want to add this into the free health care. They might want to add some extra tax so they can put in their pockets. That's plausible. So simplifying the system, maybe, like I said, adding a stipend would probably be the best option. You can justify a stipend for each citizen. There might be some slight differences, between adults and children in regards to how much they get for a stipend. Children, on average, healthcare is more geared toward children in regards to welfare. So these children are going to have to be taken care of. How much money for a child is necessary? Especially, we're talking about prenatal care, when they're 5 years old and younger, children, they need that care. So that has to be considered how much a child will get as a stipend. There's some other ways to do free health care. Instead of a tax, you can just say, okay, this is just part of government subsidy. They can get it through private businesses, maybe through donations, but it's not really plausible if you really think about it. They have systems, for some of the VA, Veteran Affairs programs for some veterans, like in the U.S. They have some of these programs that are grant-based programs, they have government subsidies, but they don't work. There's no federal homeless program. There's no true federal veterans program. There are many holes in these programs. They don't work. We got people on PTSD. We got people on the street. It doesn't work. Free healthcare, good or bad? What do you think? You're having fun? Ha 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 ha.
Happy Future Podcast.